स्वागतं कृष्ण कृष्ण स्वागतं कृष्ण शरणागतं कृष्ण इक स्वागतं कृष्ण शरणागतं कृष्ण स्वागतं कृष्ण शरणागतं कृष्ण मधुरापुरी सदन मृदुवदन मधुसूदन इक स्वागतं कृष्ण शरणागतं कृष्ण मधुरापुरी सदन मृदुवदन मधुसूदन इक स्वागतं कृष्ण शरणागतं कृष्ण मधुरापुरी सदन मृदुवदन मधुसूदन इक स्वागतं कृष्ण शरणागतं कृष्ण मधुरापुरी सदन मृदुवदन मधुसूदन इक स्वागतं कृष्ण कृष्ण भोगधाप्त सुलभ सुपुष्पगन्धकळभ भोगदाप्त सुलभ सुपुष्पगन्धकळभ भोगधाप्त सुलभ सुपुष्पगन्धकळभ भोगधाप्त सुलभ सुपुष्पगन्धकळभ कस्तूरी तिलक महिपा मम कान्त नन्द गोपकन्त स्वागतं कृष्ण भोगधाप्त सुलभ सुपुष्पगन्धकळभ कस्तूरी तिलक महिपा मम कान्त नन्द गोपकन्त स्वागतं कृष्ण शरणागतं कृष्ण स्वागतं कृष्ण 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 मुष्टिकासूर चाणूर मल्ल मल्ल विशारद मधुसूदन मुष्टिकासूर चाणूर मल्ल मल्ल विशारद मधुसूदन मुष्टिकासूर चाणूर मल्ल मल्ल विशारद कुवलय पीठ मर्दन कालिंग नर्तन गोकुल रक्षण सकल सुलक्षण देव मर्दन कालिंग नर्तन गोकुल रक्षण सकल सुलक्षण देव शिष्ट जनपाल संकल्प कल्प कल्प शतकोटि असम पराभव शिष्ट जनपाल संकल्प कल्प कल्प शतकोटि असम पराभव धीर मुनि जन विहार मदन सुकुमार दैत्य संहार देव धीर मुनि जन विहार मदन सुकुमार दैत्य संहार देव मधुर मधुर हृदि सागस सागस ब्रज युवती जनमानस पूजित मधुर मधुर हृदि सागस सागस ब्रज युवती जनमानस पूजित सा दप गरि पगरि सदस सरिग पद स दप गरि पगरि सदस ससरि रिग पद स दप गरि रि पगरि सदस सरिग रिग पग पद स दप गरि पगरि सदस तत्तिक जनदम सा दप गरि पगरि सदस तत्तिक जनदम सा दप गरि पगरि सदस तगदरि कुकुंदण कीड तगधी 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 తగదరిగు గుందణ గిడదగధీ తగదరిగు గుందణ గిడదగధీ స్వాగతం కృష్ణ శరణాగతం కృష్ణ ఇహ స్వాగతం కృష్ణ శరణాగతం కృష్ణ మధురాపురి సదనా మృదువదనా మధుసూదన ఇహ స్వాగతం కృష్ణ శరణాగతం కృష్ణ స్వాగతం కృష్ణ హరే కృష్ణ హరే
Now we'll invite the dais to the guests whom we are going to invite is Dr. Rajendra Garu, the former director of Ayush. Humbly I request him to come over to the dais. Namaskaram, please. Dr. Devendra Singh Garu, please. Professor Dr. Praveen Garu and Dr. Shobha Garu and Dr. Hari Garu. Both I request them to come out to the dais. Please, ma'am. Zoyana. 1 minute. Yeah. First, I would like to invite Harshita to come over here so that the dais will honor her. Dr. Rajendra Garu was the director of Ayush. We have invited Ayush to an exhibition and given 5 stalls at absolutely free of cost. And remember, sir, 150 medicos with meals and certificates, everything. But we were always, and he was the director, and Gurumurthy Garu was the joint director. He was more associated, fortunately, because with mission, his mission is to make you all smile, not just plastic smiles, but wholeheartedly, healthy smiles. Ironically, he is a plastic surgeon, so no plastic indeed. So that is my association with him. He just, whenever possible, he'll be with us. He'll be encouraging us. A dear friend, more than that, I have nothing to say. A well-enlightened personality. Thank you, Dr. Hari Garu, for being with us. And Praveen Garu, he is associated with and I would like to very humbly request Reena ma'am, where are you? Yeah, please come out to the dais. Give a big hand. Hey. One of the best academician I ever come across. I think a better child psychologist I can call her. Well distinguished. With due respect, we call you. Ma'am, there. Thank you, ma'am. She is associated with big schools like, St. Francis, where 6,000 kids studying, and Narayana, and many more schools and colleges she is associated. She is always behind the female children welfare is her motto, and she always insists, Murthy Garu, you come and you speak. Ironically or incidentally, ma'am, 450 colleges have become a specialist for whenever they call me, I go and give motivational speeches. Actually, that was my passion. And like that only I come across with ma'am, and she is also always invites us. We are very much thankful to her. Now, Dr. Devendra Singh, Dr. Suchanda is also there. Dr. Devendra Singh and Dr. Suchanda, both are two divine couple actually. Both are in medical field. And Dr. Devendra Singh, vascular surgeon, and Shudha, eminent doctor, very senior, and down to earth. Humility is his specialty. Thank you very much, sir, for being here. We are honored with your presence. And the most charming thing is Dr. Shobha Garu. She is 2000, when? 2020 Miss India doctor she is, Mrs. India. And what more can you have? Always doctors means with a scissor and a stethoscope. No. You can have beauty pageants also. That is the live example. So whenever possible, whenever she is in India, if she is not traveling, I would like to track and catch hold of her. And a very kind person who always working for the physically challenged and women child. She'll be working. She is a diabetologist specially. Thank you, ma'am, for being here. So before we start, I would like to humbly ask, let us start with the academician. Ma'am, say a few words. We would love to hear you. Please.
Good evening to one and all. Being an academician, it always comes on to us that we speak. So, to see that I don't keep you all too bored with my talk, I limited it, and so I just wrote down a few important lines which I thought I should rather utilize this particular forum for. I'm really happy to be a part of this August meeting, to meet doctors who are next to God, especially when we are not well, we understand the worth. It is just keeping you all close to God. And if we have to see God on earth, and if you are going to take that particular place, it depends on how you're going to take up your duty as doctors, because you are always, kept up in that pedestal. And when you're in that particular pedestal, I think you need to understand twice before you take up that particular duty. A few lines, and especially these lines, are lines of Dr. Abdul Kalam. He was one who spoke his mind very simply. Now, it is what he said. Health is a relationship between you and yourself. How true. If you value yourself, you'll surely value your health. Health does not always come from medicines. Most of the time, it comes from peace of mind, peace of the heart, peace in the soul. Health is not just about what you're eating, because what you eat affects you physically. But it is about what you are thinking and saying. What you think and what you say is also important, because today mental health has become a serious problem. If you have seen today's paper, you'll be shell-shocked to see to what extent can a human being go to harm his own friend. I hope you have read the newspaper. It was a love triangle. And to see that the one who felt that he was betrayed, he goes to the extent of inviting the boy home who was his friend. And unfortunately, it was this girl who was first the boy's girlfriend. Then she had some misunderstanding. She became a friend of this boy. And then there was this rivalry. The rivalry could not be so macabrish. He invites this friend home. They have a good time together. And then on the pretext of dropping him back to the hostel, he takes him to a lonely spot where he kills the boy, and that too in such a macabrish manner. Where is the humanness of the human being? I wonder. Because he first chops the head of the boy, he then slits and plugs out the heart, and then he rather chops off the fingers, and then, of course, his private parts. And that doesn't make him feel bad of what he has done. I'm talking of something which has come in the newspaper, which most of you would have read. If you have not, when you go back home, you can just see it is there in the very first sheet. We have to think about what are we teaching our children. Are we sensitizing them about human values? Are we making them aware that a small stress can make the person go to such an extent? So I think it is not just merely the food that you eat, but it is also what you rather nurture in your mind. So health is not just about what you are eating, that is only physical. It's also about what you're thinking and saying. Mental health is a growing problem. The other day was Shivratri. I happened to hear the program of Sadhguru. He was giving us a talk, and in the talk he spoke about mental health. He spoke about how today 1 in 3 are suffering with this mental problem. Can you just imagine having a case like this at home when your near and your dear one is affected by mental health? Are we not to see that this goes? Are we not being a partner in allowing it to happen? Today, we do find the cooking no more is in the house. You don't have to go to a hotel. Food comes home. Earlier they used to say, when food was prepared, the mother will be chanting certain prayers, and that prayer goes into the food, which becomes prasad when the child eats it. But today, what kind of food are we eating? Fast food? Food which means nothing? So even the quality of food that we are eating is affecting the children and their mentality. Are we giving them sufficient time to think? Are we giving them sufficient time to feel? Are we giving them the family values? We need to see that we built it in our children so that our children will not become children like these who can't bear stress or who can't bear a failure. So, that is what Sadhguru had told. It is not that I believe everything in what this person said. It happened that because of Shivratri, I was watching this program, and this struck me that 1 in 3 is a grave problem. And now he says the remedy is that we must give some time to ourselves, especially in the mornings. Fold your hands, he said, together and keep it close to your chest or on your forehead, and then give 15 minutes to yourself. Meditate or listen to some soothing music which can bring about an awakening inside you. This awakening inside you will draw you closer to your Creator. And that, I think so, is what we need to do and what we need to propagate. So we should draw within and meditate, chant, or listen to soulful music. This meeting here today, I must thank Dr. K.S. Murthy for inviting me here and being a part of this beautiful gathering. I got to hear so much about the activities of, the organization is called Act Now. And it is so very, very promptly called Act Now because they don't believe in postponing whatever they need to do. So whatever good act you have to do it now, because now is the time. Who has seen the future? The past is gone. So the present is what you have, and make it be a gift. So my thanks to Dr. K.S. Murthy. Thank you for your initiations that you take up to bring awareness of medical health, both physical and mental, by reaching out to the most influential group of people. When I say influential, they are the most impressionable. That's the school. And in the school, you have the children, they are young. And the children are with their two parents. That is, the parent at home, the father and mother, and a parent in the school, the teacher. So if you catch them at that particular stage, make them aware of what they need to do with their own body, with their own mind, then I think the future is secure. So I must thank you, Mr. Murthy and the group, for this initiation of bringing forth free service. It is not even charged. Free service, medical, which can reach, because people don't go to doctors just because it is exorbitant. But here, medicine is coming to your school, to your doorstep to say, where parents are invited and they by the neighborhood is also made aware. And when this kind of meeting comes in, people become conscientious of what they need to know about of health. And once this is done, I'm sure the future is rest assured. Health is a great concern, and I think we need to see that we reach out to them. Let there be many more people committed like Mr. Murthy and his group who comes up, reaches out free of charge so that people will get the benefit of it. Praying to God, sir, for this kind of activity to go on, and let many more join hands with you to make this mission a success. Thank you.
Blessings and kind words. We are honored. Thank you so much. May I call Dr. Hari Garu to take his session for 5 minutes. As I told you, he wants to spread the smiles of heartful smiles. Do you think I need more introduction, Hari Garu? Thank you.
Is most required, since we are not speaking about mental health along with the medication, all Sadguru like people are preaching. We know more than Sadguru. We know more than Sri Sri, because we are all graduated in the life sciences, but we are not speaking. Since we are not speaking, it is beautifully said by the Abdul Kalam. What is A? It is awareness. What you eat and what you speak and what we do. This awareness, if you are lacking, you are going to procure ill health. What is P? P is passionate living. J is not jealousy but joyful living. If you have this, Kalam, you will do salam for his all the sayings. Okay, all of you keep your hands like this. Some of you are very, very new people. My 1 minute time is over. Yes, all of you. Only 4 minutes are there. Most of the time, we react but not respond. I count 1 to 5. When I say 5, you have to clap. 1, 2, 3. 3. Very good. Claps, claps to all of you. Claps. Do. Yes, reverse direction. All of you, catch hold of your knee. Knee. Yeah, very good. This is how, why doctors are called very, very great people. My 2 minutes of time is over, last 3 minutes. So you have to have awareness. When you have awareness, Buddha also beautifully says, you must become aware of your body, why it is there. Deham kal dharma sadhana. Body is meant to do many, many activities, not simple mundane activities. And you must know how great your thoughts are. Most of the time, in a day, we do more than 56,000 thoughts, but only 10 thoughts are very, very essential. If you stick on to, if you are aware of your thoughts, you can do best things in the life. Okay, all of you keep your hands like this. Yes. Four breaths, short breaths. Fifth one is long breath. This is one cycle. Last 2 minutes. Let us all do. We are having smile on your face. Close your eyes. 4 times short breaths. 5th long breaths. To improve our awareness. on the life. Yes, very good. 4 times short breaths, 5th long breaths. With smile, kindly do. All of us are very, very great. But if we do combinedly, it is more great. Let us all do. 4 times short breaths, 5th long breaths. Last 1.5 minutes for our own health, for our own happiness and joy. 4 times short breaths, 5th long breaths. Yes, please continue. ఐసీయూలో చేరిన తర్వాత కాదు బ్రెత్ను గమనించడం. Let us make friendship with the breath. Last 1 minute for our own health, for our own happiness. We know we are all saviors of others. Let us save our breath, save our life. 4 times short breaths, 5th long breaths. 4 is 1 cycle. 21 cycles creates a shift from negativity to positivity, from head to heart consciousness, from awkward to awesome consciousness. 4 times short breaths, 5th long breaths for our own health. Breath mastery is life mastery. Breath is the bridge between outer and inner worlds. Last 30 seconds, we are all doing from high techs for the betterment of the empowerment of the society and ourselves. Last 10 seconds, 4 times short breaths, 5th long breaths. How many of you are feeling good? Raise your right hand without opening the eyes. Yes, so many hands are raising. Continue. Normal breath observation. Last 10 seconds. Normal, natural, easy, soft breath observation. Keep fingers and fingers like in meditation. Sit straight with closed eyes. Observe normal breath. Normal, natural, easy, soft breath observation. Society is spoiled not by the will of bad people. It is the silence of good people like doctors. Since we are not speaking about meditation, mental health, spiritual health, our service is incomplete. Health is to become wholesome. Last 5 seconds. Keep hands in namaskaram position at heart or chest, mid-sternum. As you are observing the breath, the smiles on your face is increasing, spreading all over the face, all over the body. The soulful smiles filling your heart, spreading or radiating into high-tech's auditorium. Whole body is becoming very, very light, very, very energetic, very, very powerful, very, very peaceful. Spread the soulful smiles into Hyderabad. Whole India, whole globe is smiling because of our doctors. Act Now doctors. APJ Kalam award recipients are spreading the peace, power everywhere. Thank your body. Thank our families. Thank all our enemies, our clients. నెమ్మదిగా చేతులు కళ్ళ మీద ఉంచుకుందాం. హాయిగా చిరునవ్వుతో slowly open your eyes. Big round of applause. Clap now. Big round of applause. How many of you like this session? Raise your hands. Very good, very nice. The benefit of doing this technique is most of the time we are mechanically living. See, all of you with right leg, do like this. Our life is moving very, very mechanically in clockwise direction. All of you do it because we are all scientific people. Never believe in anything blindly. Okay? Do like this and simultaneously draw 6. Change chutam. ఇలా 6 గీస్తూ కింద క్లాక్ వైజ్ డైరెక్షన్ లో గీస్తూ ఉంటే is it it is not going mechanically. When we are drawing 6, the beauty of spreading soulful smile session, the meditation is it activates all our 6 energy centers: Mooladhara, Swadhisthana, Manipura, Anahata, Vishuddhi and Ajna. These 6 energy centers corresponds to endocrine glands too. If activate చేసినప్పుడు the so called mechanical life అంటే monotonous గా వెళ్తున్నటువంటి లైఫ్ రివర్స్ అవుతుంది if we do this activity. So we can change the life of all the people, not only just giving the help. Claps. Thank you. Thank you very much.
Sir, Praveen Kumar Garu, to say a few words, as people are very slowly getting impatient, sir.
The dignitaries on the dais and dear friends, ladies and gentlemen, it's my third visit to Act Now organization, but it is not in numbers. In fact, I am connected from my heart to this organization when I heard about this. It's a great organization which has been felicitating, recognizing the services of doctors in the society, which is unique. Nobody does. In fact, any doctor's feeling would be, if a patient doesn't tell anything, we are happy. Very rarely in my 42 years of clinical experience, I received phone calls from the patients, sir, because of your medicine, I am all right. So, no news is good news. If he doesn't tell, we'll be happy. Arre, theek ho gaya, chalo. But in reverse also it can happen. So he will come and beat or abuse or bash or anything. Especially not in the clinics, but in Yashoda-like hospitals, it would happen. Fortunately, my friend did not have that. So, an organization which stands by, which tells that they are there, they recognize. There are so many slokas in our Vedas, like Sharire Jarjare Bhute, Vyadhigrasta Kalevaram, Ausadam Jannavi Toyam, Vaidyo Narayano Hari. He is equated with Hari, the Lord Vishnu. But in only sloka. But people at large, they would think in different ways and means. And I always, whenever a patient comes to me and asks, sir, can you give guarantee? We cannot, even for a fever or a cough or a cold, we cannot give guarantee. We are not gods. So if we make it clear, then patient will be happy, at least at the very outset, okay. There is no guarantee, we can't give guarantee. But if at all we tell, and if he doesn't get it, then there will be a bashing. These things are there as they are happening. So Dr. Murthy Garu, he stood and he is still continuing. Most of the organizations perform for a year, 2, then they will go into oblivion. But it is not so. And the greatest part of it, I have seen, I have been following. Silently he has been doing a lot of work. Only here he is speaking into mic, but otherwise he doesn't speak outside, and no propaganda, no advertisement, nothing. He has distributed thousands of blankets to people who are on the footpaths. He has conducted a lot of mega health camps. I am not here to blow his trumpet, but just I have seen his activity, and there is one mega health camp in April, 7th, 8th, 9th. In fact, I would request most of the doctors, if you are free, at least give your service on one of the days. It would be very useful. So such are the activities of this organization. So I am always there with them. And as I told him one word. He felt a little bad when I commented, but he said, "Sir, I take that comment." I said, "You are rigid," and you would understand later. Mostly, you would agree with me that he is rigid, but that is needed. So, with all congratulations to the people who are receiving the awards here and the dignitaries here, and of course, Dr. Murthy Garu. I take leave of you. Thank you very much.
The other day, when I went to him, he said, "Murthy Garu, you are so rigid." I said, "Sir, if you only say that, what I should say?" But a greatest well-wisher of not me, Act Now, is Dr. Praveen Garu. I can't simply thank him. Just a word thanks is very small compared to his good feeling towards Act Now, the sympathy, the anguish he feels. Yeah, so much you are working, nothing has been in the papers and the media. I said, "Sir, for the past 35 years in the media, I have seen what is media. I don't know. You might see not a single newspaper reporter here is here. We have done so many things, but never bothered to go to newspaper, because today's newspaper, tomorrow's waste paper. And social media, the less you talk, the more benefit it is. So we stopped it. We have our own documentation of what we are doing. We have our own proofs of what we are doing. If someone questions, we will submit it. Otherwise, my well-wishers are staunch well-wishers. We earned one thing in 4 years is, we earned people like Reena Garu, Hari, Praveen Garu, Devendra Singh Garu. And there are so many doctors who will be, because of them, because of their staunch feeling towards Act Now, we could do anything, sir, just because of you. A million thanks to you, Dr. Praveen Garu. May I humbly take the opportunity to invite Dr. Devendra Singh Garu. If I am not mistaken, a couple of years back we honored you, sir. It is a great privilege today to have you on this dais. Please come. Thank you.
All the awardees, ladies and gentlemen. मधुबन खुशबू देता है, सागर सावन देता है, जीना उसका जीना है जो औरों को जीवन देता है. And this is what it implies to all of you, the doctors. We should get recognition. Why we should not get recognition? We should get recognition. We should get awards. Because we are, after all, human beings. We need motivation, inspiration, encouragement, and this is what one of the style of getting recognized. Thank you very much, Dr. Murthy, because I think I was one of the first person during COVID who was honored here only in this room. Well, it's absolutely not about being a super consultant. It's being a health professional. Each one of us, in our capacity, means something to the patient. We are all directly responsible for the patient care. And that is how the line continues. सूरज ना बन पाया तो बन के दीपक चलता चल. फूल मिले या अंगारे सच की राह पे चलता चल. A beautiful song, and it means a lot to the life. It's my very favorite lines. Well, today is the day not for my speech, but of course it is to admire you people, to appreciate you people. Many, many congratulations to all of you. This is not a simple award. To me, it's a very special award. 2 reasons. One, the name, the great Kalam. One of the very finest Indian figure, I think, all of us, a very respected person. And second, of course, prestigious, the social organization, Act Now. So, to me, it's one of the finest award, and you should be feeling proud to get it. Thank you very much.
This speech, कहीं भावनाओं के सागरों में हमें बहा दिया डॉक्टर साहब आपने. बहुत बढ़िया अंदाज अनोखा था. चलिए हम भी खुश, आप भी खुश. Now coming to the point of inviting our Ayush former director, Dr. Rajendra Garu, who was kind enough to come over here to say a few words. Thank you very much, sir, for being here with us. You honored us with your gracious presence. Welcome to you.
Dignitaries on the dais and off the dais, Chairman, Act Now, Murthy Garu, Act Now is now in action, or it is in act. Generally, when we hear the name of NGO nowadays, but for the past 4 or 5 years, NGOs are in very much trouble because they were drawing much money from the others, and now the audit, all things are very much in scrutiny. The foreign money is stopped, and the organizations which are existing and working is the self-sustained organizations are now working. Just now I heard when I came into this room with the Murthy that he is not taking anything from any person. They are purely dependent on their own. It's a very good thing. That's why it is surviving even in these times, okay? It's a very good. Many organizations will do social work, means helping and doing something, patting something, giving food to others. But now, this act now is taken a very good step. Just not involving itself, it is also encouraging the people like doctors who are doing many services. So this is also encouraging by giving awards for selecting a good people for this award. Just now the Devendraji said, so I admire only one person in the politics, is that APJ Abdul Kalam. I have most respect. So in fact, any Indian must respect that particular person. An award is being given on his name is the most prestigious which I feel. So one thing is missing. Many people hate doctors because they are extracting money. Especially this became more and more when the corporate hospitals came into the things. We know what the feeling of the people towards the government doctors, because I worked in government, I headed the department also. But doctor profession is a noble profession, people will say. There are noble people even in this profession. So there may be some lapses here and there, but these doctors are always in trouble. People will think of doctor when they fall sick. They never think of when they are in happy mood. Okay. So, but that should change. Now the Indian government policy is also much more in building the hospitals, doing many things towards this, the tertiary care side, spending almost lakhs of rupees. For example, if they are spending 1 rupee towards the prevention, they are spending 400 rupees towards the tertiary, where we can't do anything. Now, there are many things in the medical field, you all know, because of the antibiotics and the knowledge towards the disease, made infectious diseases to come down. But disease burden, 49.7% shifted towards the lifestyle. So when I came across with the Murthy, first meeting in the 2018 when he wanted to conduct an exhibition that is related with the food, lifestyle. So now the lifestyle diseases are much more where there is no answer in any system of medicine. Only you have to change the lifestyle, that's it. People are thinking that health is only a physical parameters. But we all know, we are all the doctors, we have different definition for the health, physical, mental, social, and spiritual well-being. So we are leaving that spiritual part. So we are try to correct the physically, try to correct the mentally, socially also some extent, but spiritual part we are leaving it. What is spiritual health? Generally we speak about. The God is omnipotent, present everywhere. Even water, sand, everywhere it is present. So we have to respect everything because everything in the universe or in this particular earth is related directly or indirectly to our health. That is the feeling one must have. If everybody lives with that feeling, there won't be any pollution. You don't want to pollute the river if you feel it is a God. If you don't want, no person will pollute the earth if earth he feels it's a God. So such a thing is needed. That is called the spiritual health. So everything should be healthy. Water should be healthy, air should be healthy, earth should be healthy, food should be healthy, then everything should be healthy. So then only you will become healthy. So this is the most important. So my request towards the doctors and all the NGOs, building the hospitals, giving the medicines never helps to improve the general health. Only awareness, health education makes the people to become healthy. So this is most important. So I congratulate Murthy Garu and all the Act Now organization person and the award winners for this.
Show their gratitude towards doctors. He has taken this wonderful initiative of recognizing what the doctors have been doing constantly and again recognizing the amount of violence they have faced during the COVID lockdown period. Having worked in other countries and here as well, the one thing I can tell you all is in the other countries, in the Western countries, it takes time to reach your doctor. Whereas every Indian has this facility of directly approaching the doctor whenever they need them. That itself, when you are approaching the doctor through your health staff, through your surgery, and it takes time, then the value of the doctor is literally known to the patient. And what they're getting from the doctors is known very clearly. The downfall here is because the doctors are so easily available and the amount of help the doctors give. In the other countries, there are protocols. You're constrained by the protocols. Whereas here, each and every doctor takes it upon themselves not only to treat the patient with the medications, but even they sit down and have a word with the patient so that putting them into the right perspective. And all these have, and especially during the COVID period, what we saw that the frustrations of the people were taken out on the doctors. And this was encouraged by social media, by politicians, by everybody. They did not come to realize how much doctors were helping them. They did not know where to turn to. But at the same time, the people, the very people they turned to, and let me tell you, when compared to the rest of the world, the number of people who came out of hospitals, the percentage of people alive was more in our country than anywhere else in the world. So it is doubly important that we come across one person like Murthy Garu who is taking it upon himself to recognize all these and take care of the doctors and show them that yes, you have done a wonderful job and you all are still doing a wonderful job. I wish we had some more people who would do something like this. So it's always, like I said, a pleasure to attend his programs, and I think, I hope it will keep going on and on and on as it has been doing. And congratulations to all of you again, and wish you all the very best. I think we're all running a little bit late, so I'll end it there. All the best to you all again.
Thank you so much. So that is the end of our inaugural session. We'll within 5 minutes we'll honor our guests. Then we'll distribute the awards through the dignitaries on the dais to the doctors. Please bear with us for another 5 minutes. Thank you.
Outstanding pulmonologist. And the pride of SVMC.
Should be proud to have such a genius as
See, thank you, sir, for having me here, first of all. ఈ ఒక పురస్కారం, whatever it is, it means a lot, first important for me. Second important thing, it increases the responsibilities towards our society. So I'm sure we'll love to live up to the expectations of Act Now. Thank you, sir.
మాలో కూడా పోటీలోనే పెంచుతున్నారు. పంక అంటే బురదలో పుట్టినటువంటి జ అంటి అంటకున్నటువంటి ఈ పంకజ ధీరునికి గట్టిగా చెప్పండి.
Thank you so much, Act Now Murthy Garu and all distinguished dignitaries. Thank you so much. I'm Dr. Pankaj. I'm very happy and honored and grateful and humbled because we are, and my dear friend who has come with me, Dr. Aditya, we are doctors in critical care medicine, which is a very young branch, and we are happy that even we are recognized and motivated to continue our work. And thank you so much for it. Yeah.
Old age, what you call care center, tremendous work. Not only state, even central government appreciated person. Very humble, doing terrific service, sir. Later I'll give you your contact. Whatever help you could do, kindly guide him. Please come.
తప్పకుండా మన బర్త్డేస్ కానీ మన ఇంపార్టెంట్ ఫంక్షన్స్ వారి ప్లేస్లో చేసుకుంటే మనకు ఒక మంచి సంతృప్తి వస్తుంది. చాలా చాలా గొప్ప పని చేస్తున్నారు మీరంతా. కార్ఖానాలో ఉన్నటువంటి మీరు ప్లేస్ను విజిట్ చేయాలి. గట్టిగా
Assigned to one.
మీరు చేసిన సేవలకు హైలెస్ అంటున్నారు. డాక్టర్ గారు,
Give a big hand, otherwise, as I said, yeah. If anybody had not had food, please tell us, we'll bring it. But clap very bigly. You don't want to speak? Not even thanks. Yeah, ये तो बहुत. Yes. ఇది మళ్ళీ ఇది nothing but సాధారణ కారుణ్య సింధు అంటాం కదా.
ఆ సింధు క్రీడాకారుని అయింది వచ్చేమో ఈ డాక్టర్ గారు. కారుణ్య సింధు గట్టిగా చెప్పండి.
Thank you, ACNO, for recognizing our work and giving this award. It's really an inspiration for us. Thank you.
Thank you so much.
తన వైద్యంతో అపశృతిని అంతా కూడా శృతి లయలుగా మారుస్తున్నటువంటి ఈ వైద్య శిరోమణి గారికి గట్టిగా చెప్పండి.
Thank you.
Hi everyone. Thank you Dr. Murthy Garu and all the honorable dignitaries on the dais. I am Dr. Shruti, a consultant gynecologist and IVF specialist. I would like to say that we are, the young generation of doctors, are creating awareness for fertility because we are on an exponential rise in the issues and trying to solve most of them. So I would also like to take the opportunity to thank my parents for always being behind everything I do on personal and professional ground, and also my husband Dr. Krishna Kant, who's a neonatologist. Thank you once again, sir.
Thank you very much. Don't be so emotional. That is your weakness and strength.
At the outset, I would like to thank Murthy Garu and the organization for recognizing our services. As a cardiologist, I wish all your hearts stay strong and really wish none of you require my services ever. Thank you.
Sincere you are. Sheikh Mehboob Zamrut. ये तो अमृत के बराबर है. You are only option there.
feeling grateful for this opportunity to be honored this prestigious award. Thank you, ACNO organization, Murthy Garu, for such a great gesture to our doctors. And I would like to thank my parents and my husband for this constant support towards this journey. Thank you.
Thank
I'd like to thank this organization Act Now for recognizing our work, and it's really a great motivation to work more further and in a harder way. Thank you.
Thank
No, no. No. Actually, we will give one more hour. He is only entitled because he is the husband. Dr. Suchanda is the head of the department, neurosurgery in NIMS. And Dr. Devendra Singh is head of the department, chief vascular surgeon in Yashoda Somajiguda. Right. Mutual. Right. Thank you.
Both of you say, you already said, इनको बोलने दीजिए.
Good evening, everyone. It's really very kind of act now to award us to actually we government hospital doctors. We do not get calls for awards very much. That's true. I went with some fancy award fashions where they'll be doing Czech musics and all the private corporate hospital doctors will be given in a very big way. I have attended those, and I always used to think why, we also work from day to night, and it's not an easy job in a public space. And hearing, I'll take a little bit times because I want to touch upon a few points. When ma'am was speaking, I just felt that my school teacher was talking there, giving the motivational speech. And I wanted to say that for a woman in any field to rise up is not very easy. It's a saying that behind every successful man there is a woman. We find every unsuccessful man, maybe there are two women. But before every successful woman, there is a progressive man, and that's my husband. My father was not there, my brother, and of course my sons. They go on motivating me. If I don't go to conferences, my son will say, why are you not going just for us? So, they understand. So that's all I have to say. The journey is difficult, especially in neurosurgery, when we just are 2.5% of the females, and to head a department is a very difficult task. But these things motivate us, and I hope we will create more brands. And there are many females now getting motivated by our generation and coming up and taking different and difficult branches. And this award keeps us going further and further. Thank you.
It's a very emotional moment. The reason for that is 20 years back, that was the first time when we both were together at a dais during our convocation when we received our degree. And this is the second time when we are together. And thank you very much.
Kulkarni. Great, thank you. Please.
Dear friends and dear all, thank you for recognizing the good in the doctors. I would like to take this opportunity mainly to
I would like to take this opportunity mainly to put in front of you few non-governmental organizations which have helped me to, given me a platform to do seva. One of them being Doctors for Seva Group, which is a team of 150 doctors in Telangana. And then there is Satya Harishchandra Foundation, who have done a remarkable service during the pandemic, and they have even cremated COVID-19 burials. They've done COVID-19 burials during that time. And there's one more non-governmental organization I would like to point out was Sparsh Hospice for terminally ill patients. They've attended to COVID patients even at home, non-COVID patients, but terminally ill, even at home. And I have been one of those, one of my family members has been a recipient of that non-governmental organization. And last but not the least is Vivekananda Health Center, where I work currently as a diabetologist. It's run by Ramakrishna Mutt and at Indra Park, Hyderabad. So these are one of the few organizations that have given me a platform to do the seva. And last but not the least is I want to thank my spiritual guru, who have just mentioned one thing. Arjuna was there with Krishna, and Krishna had told Arjuna, whether you are there or not, Bhishma will be killed. It's your opportunity. Only you gain by killing Bhishma. So the way I look at it is, the patient will survive in spite of me. Lord has given me the opportunity to do good. So never let go any opportunity for seva. And I really thank my spiritual guru for encouraging me and instilling in me these spiritual thoughts which keep me going. Thank you, acting.
I'll start actually what is my experiences with the doctors. It will go around 1.5 hours. So kindly don't inspire me. Talk very less. Enjoy the ward and give others opportunity. I don't mean to hurt you, Sanjay Garu. It is only lighter moment. Take it. Thank you.
Thank you for this motivation, Murthy Garu. I want to thank my parents, my brother, and my teachers, especially from KG to PG, all the teachers, because of whose blessings I came here from a remote village where even the transport was not available. So to this extent I could come. This is definitely their blessings, my teachers, my parents. And by the end of the career, I am now a neurologist. I bagged 5 All India top 10 ranks. And whatever I earned is just because of blessings of all the teachers. So I thank each and every human being who helped me in my journey. And I want to thank all the patients on whom I learn. And I want to dedicate my entire career for their well-being. And I want to wish the God, whatever the thing I will do, allow me to do without mistakes. That is I am just praying for that. And I'll be with you, Murthy Garu, forever. Whatever you do, I'll do. Thank you.
Days of old age homes. For every street nowadays, we are finding old age homes. We are rising, we are getting advanced technologies. And as Dr. Rajendra Garu said, spirituality we are losing. That is sometimes we feel we are lacking it. And when I hear Kondapalli Krishna Garu, his emotional outburst is very simple. Gratitude towards your patients. Hats off to you, Dr. Garu. We are with you. Thank you. Yeah. No, this is for you. This is for you. No option left. Please.
Good evening, everyone. I thank ACNO organization for this honor. It is so motivating and helps us to serve more to the society. Thank you, sir.
This you give. This you. And absolutely you.
Good evening, everyone. I'm extremely privileged and honored to have this award. And thank you, sir, and thank you all dignitaries on the dais. And I would endeavor to maintain and keep up the value of this prestigious award. Thank you.
Both of you.
Thank you so much, ACNO, for this award. Thank you so much, sir. Thanks all the dignitaries. This is such a very big motivation, sir. At our, we are in the almost in the beginning of our very courageous and also very మోటివేటింగ్ అండ్ ఆల్సో చాలా మంచి కెరీర్ కోసం మేము ముందుకి స్టార్ట్ చేస్తున్నాం. ఇలాంటి బిగినింగ్ పాయింట్స్లో మాకు ఇలాంటి అవార్డ్స్ అనేది చాలా మోటివేటింగ్గా ఉంటుంది సార్. అండ్ రియల్లీ థ్యాంక్ యూ సో మచ్. డిగ్నిటరీస్ అందరికీ కూడా చాలా థ్యాంక్స్ సార్. అంటే మీ వర్డ్స్ అన్నీ కూడా వీల్ కీప్ దిస్ ఇన్ మైండ్ అండ్ వీల్ కీప్ అప్ టు ఆల్ యువర్ పాయింట్స్. థ్యాంక్ యూ.
థ్యాంక్ యూ.
Good evening, everyone. Thank you, ACNO and Murthy Garu, for recognizing the hard work of doctors and awarding this. It means a lot, sir. It gives us more motivation to work further. Thank you.
Thank you, ACNO. I take this opportunity to congratulate them on their extensive humanitarian services, and I also congratulate all the doctors, fellow awardees, and we try to strive up to your expectations. Thank you.
ఇప్పుడు ఈక్వాలిటీ మెయింటైన్, నాట్ పార్షాలిటీ. So meticulously planned. Next, anyone doctor left now? हाँ, आप शायरी भी बोलो, कुछ भी बोलो.
Good evening, everyone. I don't know from like for which work I got recommended to Murthy sir, but I feel when you are with great personalities, definitely I'm going to be a great person then soon. Thank you. Yeah. Thank you so much. Bless me, sir. Thank you, sir.
Thank you. Krantirmayi, Eluru, MBBS, and there are so many which I don't know. Yeah, definitely he knows.
Thank you, ACNOM organization, Murthy sir. It is really motivation for us and all the honorable dignitaries. Thank you for your motivational words too.
Fantastic. And do you think, do you have any significance in government having family planning? No, serious doubt. Rupees spent. What is the fun? Can you elaborate any one of you? I am really getting doubt.
Actually, we all know, doctors know it, but anyway, as you have asked the question, the problem is like, for example, there are 10 people who don't have food, and then 10 people who have excess of food. So that disparity is there everywhere in the world. So here also there are so many couples who are not blessed with a child because of various reasons. Without taking much time, I tell you, nowadays the fertility centers, they must be aware of it. One couple came to me after 4 years of married life. The problem is like they did not know that they should consummate to have a child. Which is like, which we cannot understand. Usually we take it, so we go through the investigations. Fertility centers, probably they may be aware. They do all that basic. So this is the duty of these centers.
I was always thinking, sir, the significance of.
Of course.
This is
Both are needed, sir. Both. Thank you.
No, he is not doctor, sir. No. इनके लिए माला बनाना बहुत आसान है। Very height. He can. Okay, sir.
Thank you, sir. I am Dr. Raviteja Ramsetti. I am truly honored in receiving this award. I thank ACNOM organization for giving me this opportunity. Thank you.
Thank you so much. This is for you.
Good evening, everyone. Thank you, ACNOM and doctors. Thank you all the dignitaries for honoring us with this award, and it is very motivating us for work further and serve people. Thank you.
Thank you. No, and see, she is honored, okay. On behalf of her husband, getting honored is double dhamaka. Your husband? Yeah, this must be domestic secret. Crack. We didn't have the privilege of seeing Dr. Rashekar, but on behalf, you want to speak something? Anyway, you won't allow there. Here also not. Take care. Thank you.
One and all. Thank you, sir, Dr. Murthy Garu from ACNO organization for giving me such a good, prestigious award, and I'm very much grateful to take this award. Sir. Thank you, sir.
So sweet. Thank you so much. Please introduce yourself, ma. You are all the way from Canada came. We are honored. Give on that. It is meant for all. Shaliba. meant for that. Danda. Bend. That's it. The lady who spoke so emotionally about her Ramakrishna Matham. Mind you, she said your name, then came to me. How could you say your name? Say a few words.
Namaskaram to everyone. Naham Karta Hari Karta. We are a family who strongly believe in this, and it's my fortune, good fortune, to have a sibling like Dr. Sandhya. You know, in one word to define her, I can say she is a modern sadhu without the, you know, the orange robes or a kamandalam. I've never seen anyone who's as kind and generous as she is. Just to introduce myself, my name is Dr. Jyoti Kulkarni, and I'm a family physician working in Canada. I trained here in India, Hyderabad, and also in Warangal. I'm a student of KMC. So is my husband, Dr. Ram Goburu. He's a pediatrician. And we did our higher education in UK, and then we migrated to US, and then in Canada. We are just like modern gypsies. But for the last 10 years, we've been in Canada, and it's my good fortune to be here to see this. Actually, only 1 or 2 days ago, Dr. Sandhya mentioned to me, there's something like this, I'm not sure if I can go, because we have few challenges at home as with our aged parents, and we have a sibling. But without Dr. Sandhya's exceptional support, I don't think I could have been in Canada in my home, sleeping in my own bed with my kids. The service that she does, not only to the family, but the lot of voluntary organizations that she's involved. And when I'm not sure if I'm allowed to talk about private things, but I'll take this opportunity, although she says no, that she was diagnosed with cancer last year. Just 1 year ago, and I think 2021 November. And this is such a strong lady who fought everything. She survived just on fluids for over 3 years. She survived just on fluids. 2021 November, she calls me when I was in the middle of doing a COVID vaccination clinic. She says, Akka, I got diagnosed with cancer. You know, within a week I was here, and then she had the surgery done. And this is just to inform, you know, when I saw her bank balance, it was negligible. The reason being, it's not that she didn't have. During the COVID time, she had distributed everything she had. You know, she's not married because she's taken the responsibility of my family and for personal reasons. But she said, if something happens to me, it's just me. But during COVID time, if something happened to a family, you know, who couldn't afford the medication or do, then, you know, the entire family would get upset. She's given away so many things. To this day, you know, I don't know how many hair I have. More than that, you know, so many people come and thank us for having, and, you know, I can't ask God for more. You know, it's my good fortune to have a sibling like her. I'm so proud of her. Thank you for giving me this opportunity.
See, warriors are there always between us. We don't recognize. She is a warrior, not in one. Cancer is a small, tiny thing. If cancer doesn't come, also will die. So no need to cancer bhutamu. I don't believe at least cancer. But living for others, that is the big thing. Give a big hand to Dr. Sandhya. We are proud of you, Sandhya garu. Thank you so much. Thank you. It's a pleasure. Thank you. I know, Sariga. Still, you can take.
He can only, not you.
Surely, no?
Oh, we should wish we don't go there.
Thank you so much. Okay, sir.
Yes, good evening everyone, and respected dignitaries on the stage. Act now. Thank you so much for this token of encouragement. Another bittersweet, sweet moment. I'm taking this award alongside my colleague since 16 years, Dr. Pankaj. And also my wife, my kid is here, Dr. Aparna, and Devendra sir. Yes, Devendra sir, she is actually taking. Yeah, she is. And
that kid, where is Ananya?
She is playing somewhere, but Devendra, she is pursuing vascular surgery in Apollo, and you are her source of inspiration. Hopefully that you would keep her inspiring her. Thank you so much.
Next join Yashoda.
Yes. There was, I mean,
What about his safety?
unfortunately,
He is already critical.
we were eyeing for Yashoda, but unfortunately it didn't work out. But
It's okay. After completion, she can come. No?
definitely, sir. Thank you so much for the inspiration. Thank you so much, everyone. Thank you.
Give a big hand for both of this young couple. Thank you. Now, anyone left, please? Yes, from ACNO, sir.
Rakesh.
Acha, acha. Wow. Next, who is there? Hey, Miriddarali. Come here. Udda. Kuchu. Now, no one left. He is also mad. One star. Sir, again, this also you. This, yes. You can do. You both. Okay, sir? So that what happens, you will travel and you will have to discuss. Thank you, Raju. Dr. Praveen Kumar Garu, as I said, thanks is a very small thing to say. So I thank Dr. Praveen Kumar Garu, Devendra Singh Garu, Dr. Rajendra Garu, and my very good teacher, philosopher, guide, Srimati Reena Garu. So don't be scared. I won't be talking 1 hour, 10 minutes because I am exhausted already. I don't have that much energy. Otherwise, I would have taken the privilege of speaking that much time. Even though you are all fans of my speech, but I am stopping this. Somebody said, अरे यार मुझे गाना नहीं आता फिर भी मैं नहीं गा रहा हूँ मेहरबानी कर चुका So be privileged, go and have a cup of tea, bless Act Now, and there will be so many calls for you from Act Now to refer doctors. Don't hesitate to refer. We will not do any harm to them, only honor them. Thank you so much. Thank you, thank you, thank you. Thank you very much, sir.